evening and welcome to the AIDS Call-In Live. My name is Sister Ya. I am with TACTS, the Association of Clinical Trial Services, and this is our AIDS Call-In Live. We haven't been here since we've moved to the new studio, so I want to welcome you back. Hopefully you had some trepidations about where we were and when we coming back. Well, here we are with TACTS, the Association of Clinical Trial Services. What I do, I am the community epidemiologist, and I provide the science to the people. That's what TACTS is all about, the Association of Clinical Trial Services. Here on the AIDS Call-In Live, we want you to be able to call me and ask questions about anything that's pertaining to HIV, AIDS, of course, with the infection that causes AIDS, of course, sexually transmitted infections, as well as other comorbidities such as obviously hepatitis and maybe some other STIs. So this is what we do here. I am so glad to be back. I want to welcome my new assistant I have, Mr. Charles Patton. He's going to be taking your phone calls. So you call that number at the bottom, 312-733-1068. I can't quite see that. I hope I know 60, excuse me. Call the number at the bottom and make sure to ask us a question at the AIDS Call-In Live. So what are some of the points that we have here today? I want to bring your attention to knowing that we should have diversity in clinical trials research. That includes biomedical prevention trials, science-based trials, which are the case-controlled trials, the treatment trials as well, and it includes advocacy. Oh, wow, I see we got a caller already. Welcome to AIDS Call-In Live with Sister Ya. What can I do for you?
First of all, may I say welcome back.
Hey, thank you. I can't quite hear you. Can you turn them up a little bit?
Can you hear me now?
Okay, go ahead.
Okay. A lot of different types of problems that's out here right now. There is a solution to your problem, but when it comes towards the different people that finance it, if it ain't no money involved and a big payoff, guess what? Those treatments are not getting to the people because especially with pharmaceutical companies, they're not going to put the money out. They're not going to get a return back because there are different types of remedies for different types of health problems. Yes. But guess what? It ain't no money in it. They're not going to finance it.
Well, I appreciate that concept, caller. You're bringing up a very good point. And you know what TACTS does? We speak truth to power. What you just talked about was pharmaceutical companies, right? Industry, which has all the money, right? And they're the ones that do and finance the research and development. And if it doesn't seem like something they want or something that would make them lots and lots of money, profit, if you will, then it seems as though they will not get involved. But guess what, caller? I'm here to tell you that it's not always what it seems, that even the small fire can burn. Even when you just one drop of water, you can make a ripple effect. There's a woman who actually had a social pharmaceutical company that she started. It was for the people in it's in the continent of Africa, but I forget which country. She started a pharmaceutical company which helped to eliminate some of the worms from without. They were eating some type of food and they were getting these worm effects, and so they figured out how to manufacture the actual drug that they needed right there on the premise of where the people lived. By doing that, the drug production, the sales of that went right back to the community, and she didn't take profit for doing that concept. That was called social pharmacology, and it's very rare. Most of her funding had to come from the Bill and Melinda Gates Project. She had been turned down at least 5 years. And by the way, she was one of the top executives at a pharmaceutical company, and she was a chemist on top of that. A doctor of chemistry, if you will. And she saw the need and decided, guess what? I'm going to be that change I want to see. Since then, after starting her first company, she went ahead and started another company working on women's issues. I haven't heard from her since, but you know what, caller? I'm going to make sure to find out. So what you just brought up is there are examples of people who are speaking truth to power. There are people who are going to be the light. There are people that's going to be that ripple effect, if you will. And we just got to find them and make sure we sing our song, even if no one's not listening. Thank you, caller, for that insight. Again, this is the AIDS Call In Live with Sister Yar, your community epidemiologist. And with the I'm discussing, I want to make sure that you know why TACTS is here. It's to do exactly what the caller just talked about and alluded to, is that even when we know things are wrong, some of us got to do it right. Even when we don't see the profit per se, we have to know that the real profit is in human capital and might not be in the dollar capital. So we've got to be that change, which is why we started TACTS, the Association of Clinical Trial Services. The reason being is that we believed in diversity in clinical trials research. Now, when I talked about clinical trials research, I was mentioning biomedical science, treatment, and advocacy. And as a community epidemiologist, in this role, I take on the advocacy aspect very seriously. Because I understand the science, that's what TACTS does, is bring the science to the people, and we explain it, and then we find ways to speak truth to power. We find solutions, not just keep talking about the problems. One of our solutions is to make sure that people know what is a clinical trial. Okay, there are several types, which is why I was bringing your attention to the different ones, the biomedical, the science, the treatment type of trials. Hey, I got a caller with the AIDS Call In Live. Welcome to Sister Yao. What can I do for you?
Yes, I want to make a couple of points if I might, and I think you raised some important issues. And unfortunately, there's two sides to this. On the one hand, we need to encourage that large biomedical companies, various other pharmaceutical companies, that they have the kind of outreach that allows for diversity, and that is certainly essential, and it sometimes is lacking. And at the same time, within various minority communities, there also needs to be good messaging, because there is unfortunately the perception, what's been called the sort of conspiracy mindset,
Yes.
That exists in certain communities, that that if I lend myself to a study or a trial, that God knows what they're going to do to me. I mean,
right.
You're not surprised. Certainly, I'm not to find that there are many people who think that all sorts of diseases are something that is part of a conspiracy on the part of the government. And people actually believe this nonsense, despite the fact that there's no validity to it. And I think that keeps some people, especially in the minority communities, from participating in things because they have an inherent suspicion of government and of these companies. And the question is, how do we get both sides to the table to get more people to participate? Because again, if a trial only focuses on, say, middle-aged white men, well, we have no idea how that medication is necessarily going to affect young African-American women.
Absolutely.
If they're not
right.
part of that. So people need to understand how vital it is to have people who are of diverse backgrounds to participate, because the reality is that there are slight differences depending upon our backgrounds, and that affects the way that medication affects us.
Yes, sir. So, caller, excellent points. I get what you're saying. I need to address something very specific, though, if I can. Let me be clear. When there's been several studies out, and one of the latest studies that came out in 2015 actually asked a plethora of black people, black men and women, adults, would they participate in a clinical trial? And overwhelmingly, it was over 80% that said that they would participate in a clinical trial. So at the time, when people thought that blacks wouldn't participate, actually they would if they were told the right information. So we have to get past this thinking that black people aren't participating in trials. Actually, they want to if they are asked. And that's what's not been happening. So I needed to just correct and redirect you a little bit, and we're going to get into that. Very good question, very good insight. Hey, I got a caller with AIDS Call In Live. We're going to have to make this a little quick, caller. Go ahead.
I will. First of all, the last caller, Steve, don't stay away too long, okay? Second of all, there have been situations where people they should question, and they have, even the government had done clinical trials that wasn't so ethical.
That's right. You're absolutely correct.
Your best ask questions, because doctors, they get to bury their mistakes.
You know what, caller? Thank you for that. I want to bring your attention. I didn't get your name, but I want to bring yours and Steve's and the other callers' attention to this book that you see up there. It's called Medical Apartheid, and it was written by a colleague of mine, Harriet Washington. She is a medical ethicist, and she dealt with exactly what you just portrayed, which was there has been egregious and malevolent acts perpetrated against blacks in clinical trials and health research. It didn't matter if it was a trial or not. In fact, your whole mortuary science, if you will, the reason that they understand how to work with dead bodies is that they were exhuming the dead bodies of African and black people without their permission. The government sanctioned that, and in fact built some of their best institutions off of that, including Rush University. A lot of people don't know that's how it got its start, but we do know that is one of the aspects of mortuary science. A lot of people should actually, I encourage you to learn about these historical malevolent behaviors. They need to know, and again, I want to show you this cover of this book, they need to know that apartheid, medical apartheid, had to do with xenophobic concepts of not wanting to treat everybody the same because we were considered some type of other animal, some type of difference. I mean, they basically treated us like what? Guinea pigs. I know you've heard that terminology. And that's true. What TACTS does is not deny the truth. We actually embrace the truth. We like, what was that movie? It's like, you can't handle the truth. Oh, yes, we can. And in fact, we're going to bring it. We're going to tell you, yes, we're going to collaborate and corroborate the truth about what has happened to us as people of African descent living in this country. It is not pretty. It is not good. But one of my other callers did make a point. We still have to participate. We still have to do our best what it is we know. Not getting in a trial just because of what the government did. I am going to throw it back out to my callers and my listeners and say, who is the government? Who is it? Remember, these are not monolithic. They have monstrous concepts, but they're people who are portraying these monstrous concepts. So who is the government? We have to challenge, again, speaking truth to power. So I want you to understand that concept and deal with the fact that we must be our own best advocates, which is why I have it on this page. One of the concepts around advocacy is making sure that when things are done wrong or malevolent, that we speak truth and we correct it. Now, there are some situations that are out that we're going to have to deal with. I wanted to just very quickly give a shout out to some of the people that has been going to be helping me and have been the Center for AIDS Research, of course, Men and Women's Prison Ministry. I got Flow Photography and Enterprise. He know I did that. That's Mr. Charles Patton, the AIDS Foundation of Chicago, and the National Black Agenda Consortium, where we are setting an agenda for people of African descent. And you know why? People that, doesn't know their roots, they can't bear no fruit. So we got to make sure we know our roots. Guess what? I got another caller online. Can we make it real quick?
I am going to make it real quick. Let's don't forget back in 1976 when the government was trying to get people to take those swine flu shots, and even had the president at the time, President Ford, and they found out it was a lot of different side effects to those shots. And then some of those shots that we take today, if someone winds up dying because of a bad effect, the most amount your family can get and it's a lot saying somewhere like $200,000. So you best question certain things. What's going on in your body? What you're doing to it.
Caller, guess what? I'm getting a signal that I have less than 5 minutes to finish up. But thank you so much. I appreciate. He was actually given again the account of what has gone wrong in several different factions. There's not only back in 1979 and 1980, which he's referring to. Guess what, you all? We're dealing with a vaccine issue right here today in 2016. I'm not going to get into that today on this show. I need to do a lot more preparation, and I think I'm going to have to be very careful in how I move forward because the allegations are very serious. But I am going to say right here, right now, I am in support of what the Nation of Islam and some of their associates have taken on this fight because they want to speak truth to power. And the fight is unfortunately against the Center for Disease Control for allowing a vaccine to continue to be used after they found out that it might not have been the most ethical and efficacious thing to do. So there's a lot of back and forth, and I just found out that they didn't do a case control study on that vaccine, so it's hard to have a comparison and see what worked, what didn't. So that's going to be another thing we get into later. One of the things I want you all to know, we're going to deal with community preparedness, and that's just what we're doing right now. How do we prepare our mindset and benchmarking, antiretroviral therapies, behavior, mental and health, microbicide vaccines, STI control. I have a caller, and caller, you only have 10 seconds to speak, so please be very quick.
I just wanted to make the point that to date there hasn't been a single study that links vaccines to any kind of condition. There have been erroneous studies that contend the vaccines are linked to things such as autism. None of that ever panned out. As a matter of fact,
thank you. Caller, I only had a few minutes. I couldn't keep you on. That piece of information for people who are watching is not true. Actually, CDC has put out, other factions, other researchers have put out the fact that there have been, and they had a recall on, in fact, on a meningitis type of vaccine that had to stop being produced. So unfortunately, caller, that's not true. They have had vaccines that did not work, that had issues with them, that did need to be recalled. That is not new information. It has happened. There have been accounts of too much mercury being put in some specific vaccines over a period of time. Again, there has been the research. I implore you that you do your research before you make those allegations. But I thank you so much for allowing us to have this conversation. These are the kind of things that we need to do. The callers have good points, and they have some misinformation that we hope to correct and redirect. But one of the things we want you to do is what? Keep being an advocate. So the answer to the question is yes, we should continue working in this field. I had a wonderful time at our event for the Women's Social Health Networking Social. I wish we could have spent a little bit more time talking about that, but we're going to have some other things come up. Pretty soon, we're going to be doing an event with the City of Chicago. Is going to be at the Humboldt Park here for Healthy 2.0, which means that it's benchmarking how it is that the health in the City of Chicago can get better. I should have had the link for that, but contact me. I'm at TACTS, and I can show you here in my form. I'm at taxforus@gmail.com. That is what you can do to contact me by email only, taxforus@gmail.com. Again, I want to thank the callers. I want to make sure that this is our first time back in the new studio. And I want to say it's going to be a wrap real soon with my colleague, Charles Patton. And we are TACTS, the Association of Clinical Trial Services. Tune in to AIDS Call-In Live with your community epidemiologist, hostess, Sister Ya. Thank you.